To health-related stories, it's official, the Omicron variant, which is largely driving a fourth wave of the COVID-19 pandemic in other countries, is now spreading within our communities here in Ghana. At least 7 cases were detected after the latest sequencing of samples collected from the community. Last week, health officials found 34 cases of Omicron among travelers who are arriving at the Kotoka International Airport. This led to the introduction of new guidelines to prevent the further spread, including a no vaccination, no entry policy. But even before that could take off, the Ghana Health Service says the Omicron strain is already spreading inland. Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaje, disclosed this to Emefa Apo on The Probe.
We saw the first group of about 34, and that was those at the airport. At the time, we had sequenced about 66 community samples that were negative. Okay. The current one is giving us some Omicron in country. I think about 7 of them have been reported within the community sample, but that is to be expected because we are letting as people enter. They are more likely, we may be having people who are incubating, so we have seen some now. But still, the leading variant is still the Delta among the community.
Okay, so you've talked about 66 communities. Earlier you said 34, but I was asking if we know how many exactly in terms of Omicron after the sequencing, because the earlier communication was 34. Has it increased? Do we know how many exactly?
The 34 was for the 116 at the travelers that was done. At that same time, we had done about 66 community samples, which were labs within country, and that's 0 for Omicron. The second batch, and I think about 40 or so, we have seen some Omicron in country.
And you say that's a 7, so in addition to the 34, that's all?
That's what we know.
Okay.
That's what is recorded.
Okay. Well,
so as you go on to do your sequencing, you may find some. The most important thing is that it is in the community, and so that's what the caution for us to be more careful.
So are we chasing it? Do we know we are in control? 7 in which communities you would want to tell us?
The most important thing is that all the preventive measures that apply, as to whether it is prevention through the mask wearing, hand washing, social distancing, they still work. Vaccines still work. Even though there is some evidence of some escape, it still works. So all the measures that we have still apply. So what we need to do is intensify it and make it more effective to prevent transmission from one person to another.